Hello, and welcome back to our 2020 Cancer Wellness Speaker Series. I'm Lori Ball.
And I'm Kathy Alexander. We are so happy to be here with you today for Faith and Gratitude's presentation.
Faith and Gratitude is a nonprofit organization dedicated to providing empowerment and education to cancer patients. Key to this focus is producing events such as this virtual series for patients and caregivers.
We realize everyone's journey is unique. Our mission is to arm patients with the knowledge and resources to strengthen their mind, body, and spirit during treatment and beyond.
And this series is doing just that, bringing you knowledge that can help you on your healing journey. We are so happy to share today's presenter with you, Rick Shapiro. Former practicing attorney, Rick is a leading consultant, researcher, and educator in the field of evidence-based integrative cancer treatments. He collaborates with internationally renowned doctors and researchers who are at the forefront of innovative therapies. He has consulted with and coached cancer patients from all over the world.
Rick was inspired to delve deeply into cancer research after his own father battled cancer. This hard journey raised the question in his mind: what is enabling some patients to defy the odds? What have they done differently? After meeting and interviewing hundreds of patients who had beaten cancer and having the privilege to confer with oncologists around the world, Rick had a wealth of knowledge that he felt called to share.
Today, Rick will talk about this journey and the culmination of his work that inspired him to write Hope Never Dies. It's an incredible, insightful book that brings to life how 20 late-stage cancer patients beat the odds, along with compelling insights from the medical community. I met Rick a couple of years ago and was drawn to his message immediately. As an ovarian cancer survivor myself, I know firsthand the paralysis that washes over you, your family, and friends when you're first diagnosed.
Rick's message from the perspective of both patient and doctor is truly one of hope and inspiration for everyone involved. We're looking forward to his presentation. Let's hear from him now.
It is my great pleasure and privilege to participate in the 2020 Faith and Gratitude program. First, I want to congratulate Lori and Kathy for putting together a wonderful nonprofit organization that has the power to change and, in fact, save lives. It's an organization that is tremendously worthy of your philanthropy. So now let's get started. My name is Rick Shapiro. I'm a former practicing attorney. I don't practice anymore. Part-time, I offer financial advice to CEOs of companies looking to divest themselves of their companies. But my real purpose and passion in life is informing people of effective, evidence-based, safe treatments and therapies that can beat cancer, support the immune system, and get us much greater outcomes. That's what I live for, and that's what I do. So how did I get started into this whole world of cancer? Let's talk about that. In January of 1996, my father had an aggressive lymphoma, an aggressive cancer. Prior to that, he actually had breast cancer and prostate cancer. He went to the hospital and the doctor said, we need to bring out the big guns, a highly potent chemo. He went through one cycle of this chemotherapy and it almost killed him. The nurses thought he would die within 48 hours. He didn't die from that chemo, but the side effects were horrific. And it made me question chemotherapy and the horrific side effects that brought upon my father. In February, 1 month later, the doctor said, we look at your dad's situation as terminal. I felt helpless and hopeless. And at the end of March 29th of 1996, my father died of cancer. It was a tough and difficult time because my dad was an amazing and most wonderful father, as was my mother as well. I was very blessed and lucky to have two fantastic parents. In 2001, 5 years later, I had a personal scare. I wanted to increase my life insurance. I had blood work done by the nurse to assess my health status. And they came back and said, we will give you more life insurance, but we will not give you the best rates because you have very high liver enzymes. I didn't know what that meant. I sent the blood work to my doctor. I said, is this something or is this nothing? He said, come on in. Long story short, he did an ultrasound. I had a CAT scan, and he sent me to a specialist. the doctor said that I want to do a biopsy in your liver. My numbers were escalating and getting higher and higher and higher every month. And the process of going through these scans and blood work was over several months. He said, let's do a biopsy. That made me very nervous. I said, give me 30 days before we do the biopsy, and let's see if I can alter the path of these liver enzymes. Let's see if I can bring them down towards the normal range. I read a book by a doctor in Australia and a book by a doctor in Europe, and I made radical changes in my nutritional habits, big changes in my dietary nutritional habits, and I took several supplements that I felt would be helpful to my liver. Guess what? 30 days later, I brought the numbers down significantly, and in 6 months into the normal range. So no biopsy. And then I decided that, you know what, with nutritional changes, perhaps we can alter the disease process. Perhaps we can make material changes on our health status beyond just pharmaceutical drugs. This made me delve into greater research about cancer. And when it comes to cancer, when you reach the age of 50 and up, and even more so 60 and up, that's where you have most cancer cases. There are pediatric cases, younger people get cancer, but 60 and up is where you have the great majority of cancer situations. Lifestyle. So PubMed.gov is an online library with over 27 million studies. It's governed by and under the jurisdiction of the National Institute of Health, PubMed.gov. And you can learn a lot from PubMed.gov. So I went to that particular site and I put various words into the search engine. For example, you could put the word curcumin cancer in. Curcumin is a supplement, and I came up with over 4,000 studies, and I delved deeply into these studies regarding many particular approaches. Then in 2010, I went to my first cancer conference in West Palm Beach, Florida. Since then, I've been to 30 conferences, and I've been to Mexico to evaluate the cancer clinics in Mexico. I also, during this time frame, reached out to cancer specialists nationwide and here in Arizona. And I wanted to find out, from a rational perspective, because I'm basically a logic kind of guy. As a former practicing attorney, I look at things logically. Can you really beat the odds? If you have stage 4 cancer or terminal prognosis, can you beat the odds? What makes you think that you can when you have these so-called experts saying that you can't? Well, I just wasn't so sure that I was going to accept this general consensus. I decided after much research, many conferences, and deep research in this area, that I needed to let people know that there are other things that you can do integratively or complementarily to beat the odds of even late-stage cancer and terminal prognoses. There are no guarantees in life. I don't state that everyone will beat the odds. There are no guarantees, but you can certainly optimize your outcome. The book is comprised of three sections, 20 stories, inspirational stories of people who beat the odds, who had all kinds of cancer: breast, colon, lung, prostate, brain, pancreatic cancer, ovarian, kidney, melanoma, bladder cancer, etc. Part 2 are deeply instructive interviews I did with 5 renowned cancer specialists. That includes Dr. Keith Block, Dr. Gene Wallace, Dr. Robert Nagurney, Donnie Yance, and Dr. Dwight McKee. And part 3 are 83 critical questions that you must ask your prospective cancer doctor before hiring him or her. You're the boss. You're the patient. You make the decisions. Don't be a lemming or a sheep. Ask questions. Be empowered with knowledge. So part 1, the inspirational part, here are 20 stories. I use real names, no pseudonyms. Part 2, illuminating interviews with people, what they do to save lives. These are the cancer docs. And part 3, questions to ask. Don't be shy. Don't be a lemming. I learned through this whole process that you are not a statistic. When a doctor says you've got 3 to 6 months to live, he or she is looking at studies of tens of thousands or hundreds of thousands of people. But you're an individual. Your mutations may be different. After you get this dire prognosis, perhaps you will change your biochemistry. Perhaps you will incorporate other methodologies, treatments, or therapies that conventional medicine doesn't bring to the table. There are many things we can do to alter the disease process. And I know so many people, well over 500, that are here 10, 25 years later. Not just 20, but I know hundreds of people who have beaten the odds of dire cancer prognoses. You are not a statistic. Remember that. What about the concept of attitude? Does attitude matter? Unequivocally, yes. Think about any particular endeavor or accomplishment that you want to go after, if you want to climb that mountain, it takes a lot of work, it takes effort, and your attitude matters when you try to conquer that mountain or any particular project. So certainly when you get a cancer diagnosis, it's normal to be highly anxious, highly stressed, perhaps even depressed. Our mortality flashes before our eyes. That's understandable. But a few days after, a week after, 2 weeks after, we need to try and find that inner spirit, that fighting spirit that allows us to go forward with a plan, putting a plan in place to deal with this thing head on. Look forward and keep going. It is critical. So what kind of a plan? In my opinion, and based on my experience, and based on talking to these 20 people and hundreds of others, a multifaceted, multimodality plan, comprehensive plan, not a singular silver bullet plan, not just, oh, let's do chemo and hope it knocks it out. That's not good enough to optimize your outcome. A multifaceted, comprehensive plan delivered by sophisticated experts, doctors and or healthcare practitioners. They may not be medical doctors, but practitioners. They could be naturopathic doctors who specialize in oncology, or specialists who are experts in nutritional oncology or supplementation oncology. So multifaceted, comprehensive, delivered by sophisticated doctors, personalized to you, personalized to the individual. We don't want to have a generic approach. It needs to be based on objective criteria pertaining to you. What does the word objective criteria mean? That means based on blood work, tissue samples, things innate and pertinent to you. And we want this plan delivered with compassion. If you don't have someone who's going to fight for you, then get another doctor, find another team. But you need people who are going to be compassionate and fight really hard for you. Evidence. Lots of conventional doctors say anything beyond standard of care. A standard of care is chemo, radiation, and surgery for the most part. Anything beyond standard of care, they say, is nonsense or it's unproven. Well, that is not true. What is standard of care? How do you get standard of care drugs approved? Well, you have to get drugs approved through the FDA, the Food and Drug Administration. And they have a test called the gold standard. What they do is they look at cancer cells with their new drug under a microscope. Then they will do an animal study with mice to see how this drug works with mice. Then they'll do a phase 1 study, 50 people approximately. Phase 2 could be 200 people. Phase 3, 300 people and up. And these studies customarily take 10 to 15 years. And according to Tufts University study of drug approval done in 2014, it costs $2.5 billion. That's billion with a B to do these studies. Who can afford that? Well, the pharmaceutical conglomerates, the giants, can afford it, because if they get something approved, a drug approved through the FDA, they have a 20-year patent. Think about all the TV commercials we see today that are pushing certain types of drugs. You didn't see these television commercials 20 years ago. It's frightening. You're not going to get natural agents to go through this kind of a study. Let's say I said to you that curcumin can be very effective to mitigate inflammation. By the way, inflammation drives cancer, and cancer drives inflammation. But curcumin is a natural agent, and you can't patent it. You can sell curcumin yourself. I can sell curcumin myself. It's sold by many people throughout the country and the planet Earth. But you can't protect it with a patent. So no one's going to spend $1 billion or $2.5 billion to do a study because you can't get a return on your investment, and you can't protect that particular methodology, but you can protect the drugs. So I will state without hesitation that there are lots of evidence, epidemiological evidence, observational studies, case reports, case studies, clinical evidence that strongly supports the notion and shows that lots of other things beyond FDA-approved gold standards can work well. And by the way, in brief, the gold standard is essentially a phase 3, double-blind, placebo-controlled, large randomized study. But there are things beyond that that work quite well. So what kind of modalities and approaches work? I mentioned before, multifaceted approach. Well, there's mind-body therapies. So what do we mean by mind-body therapies? There's all kinds of mind-body therapies, quite frankly. Meditation, for one. And different things work for different people. Prayer can work for lots and lots of people. Humor. Some people say laughter is the best medicine. Music. Nice calming music or whatever music works for you. Stress reduction classes. So there are lots of approaches that can work to calm us down. Visualization is another one, where you might visualize little Pac-Man in your system eating up cancer. So meditation, prayer, humor, music, stress reduction classes, visualization can be very helpful. We want to mitigate that stress and fear. And by the way, fear, as an acronym, FEAR, forgetting every available resource. And again, there are many resources that we can incorporate and implement to support our immune system and fight cancer. So I want to quote Gene Wallace. Gene is brilliant in the nutritional oncology area. And Gene said, quote, "A cancer diagnosis is one of those times when we find ourselves unexpectedly tossed from the vessel and immersed in turbulent waters. We can choose to struggle and exhaust our resources, or we can choose to let go, relax, breathe calmly and deeply, and simply allow the waters to support and carry us. Don't let cancer take over your entire life." And so right she is. What about nutritional strategies? Nutrition is core and foundational and critical. Everybody on the planet eats food of some kind or other and drinks liquids of some kind or other. Well, there's lots of different diets that you may have heard of. There's paleo, vegetarian, vegan, macrobiotic, Gerson, keto. What's best for you? Well, in my opinion, it should be individualized to you and for you based on, again, objective criteria. Blood work, various tests, so we can eat certain food that helps get you into the appropriate range to best fight your cancer and make your body inhospitable to cancer. Excuse me. Gene Wallace says, quote, "Tailoring a protocol to the unique needs and biochemistry of the individual is foundational to our approach. Measurable parameters associated with outcome can be modulated by diet and lifestyle interventions." Now, of course, there are common sense things that we'll address briefly. For example, eliminate and mitigate refined and processed foods to the best of your ability. Excess sugar and sugar equivalents should be eliminated. Get rid of that ice cream, candy, cookies, all of the confectionery junk. Also, try and stay away from GMO, genetically modified foods, if possible. So many foods have artificial ingredients, which are just not healthy for you. Lots of foods, for example, lots of plants have pesticides and herbicides and insecticides throughout the plant organism. We want to try and go with organic plant foods if possible. And a plant-based diet is really important. I'm not saying it has to be a plant-based diet, but a plant-based diet is optimal. It's okay to have animal protein, but if you have animal protein, make that the appetizer. Don't make that the main part of your dinner or your lunch. And if you do have animal protein, we want to avoid that stuff which is factory raised in an institutional setting. Because when that cattle gets shot full of chemicals and antibiotics and hormones to make the cattle fatter for the butcher, or to make the cattle produce more milk, or the chickens to produce more eggs, or the fish to become much fatter than they normally would, that as pertaining to what Mother Nature intended. So go with organic, wild, and pasture-fed if it happens to be cattle. Organic food without all of these chemicals is really important. Include, however, in your diet, include things like vegetables and fruits, essentially plant-based, lots of greens, broccoli, cauliflower, things of that nature is really quite important. Fresh vegetables and some fruit. How about Keith Block's attitude? Keith is a doctor out of Chicago, and he said, quote, "Nutritional therapy should be standard of care." Standard of care, and it's not. He said, "Our ignorance and lack of attention to nutrition and integrative care hastens, not only the disease process, but also the dying process, period. He said, it's clear the typical Western diet can drive the onset of malignancy, unquote. And he also said, one study showed that when breast cancer patients reduced their fat intake to 20% or lower, they reduced their risk of recurrence by an average of 24%. This is on par with tamoxifen, which has shown a 25% reduction in recurrence rates when taking it for 5 years. One more comment from Gene Wallace. Gene said, since 1971, we've declared and waged a war on cancer with aggressive, toxic, and expensive therapies to kill the rogue cells. With this mindset, it's reasonable to question how some wimpy foods or supplements could have any effect against our most formidable foe. Medical doctors are not trained in the science of how foods and nutrients contribute to health, and they have no tools in their toolbox for this job. Well, in my opinion, forks can be a really good tool to use when used appropriately. What about supplementation? Supplementation gets a bad rap, in my opinion. You can get supplements anywhere and everywhere. Certainly you can get them at the local supermarket, at Costco, at the drugstore. Everyone sells supplements and you can buy them online. So there are certain supplements that are very effective, evidence-based, and safe. And it's important to know what works best for your cancer, your stage of cancer, and make that part of the multifaceted approach. There are botanicals, there are vitamins, there are extracts, there's liquid forms of supplements, pills, capsules, IV, etc. The concept of dosage and timing and synergy is critical. Think about it. When you go to the doctor and they give you a particular drug, a pill for something, dose matters. And there's all kinds of range of dosage when you take it, with or without food. The same thing applies to supplements. So regarding the concept, getting back to evidence, there's a ton of evidence that shows and demonstrates clearly the power of appropriate supplements. Again, evidence-based appropriate supplements for your condition. Epidemiological case studies, case reports, observational studies, clinical evidence, etc. And these supplements can be both supportive to your immune system and cytotoxic. Cytotoxic means going after cancer cells and killing cancer cells. Toxic, cyto. Toxic to cancer cells, to cells. So supportive and helpful in going after the cancer. Donnie Yance, who's brilliant in the supplementation oncology arena, said, quote, the scientific data is overwhelming on the benefits of herbs in oncology. Dwight McKee, an oncologist in California, said, quote, vitamins, botanicals, extracts, and other types of supplements can be very, very effective. Studies regarding supplements. If you go to PubMed.gov and put into the search engine just the word curcumin cancer, you'll come up with more than 4,000 studies. If you put the words in green tea cancer, you'll come up with more than 4,000 studies. If you put the word in vitamin D cancer, you'll come up with more than 10,000 studies. Thousands of studies that discuss and talk about the impact and effect of these things pertaining to cancer. Another modality, exercise. I've never heard of anybody saying that exercise is bad for you. Certainly you need to be careful if you are compromised, but exercise has many benefits. It stops the decline of muscle mass, alleviates stress and anxiety. It increases the flow of oxygen-rich blood to the tissues. Oxygen-rich blood. It reduces fatigue and nausea, and it enhances sleep. It helps people sleep, and sleep is really important when you're sick. Dr. Dwight McKee said, and Dr. Block said, exercise in many forms can be very, very helpful. So let's talk about chemotherapy for a second. Is chemotherapy something you should do or that you should not do? Well, if you asked me 20 years ago if I thought 15 years ago to 20 years ago chemotherapy was something you should do, after what I saw it do to my father, I would tell you no, avoid chemotherapy. But my perspective has changed, perhaps evolved. And there is a place for chemo in certain circumstances. For example, if you have a very fast-growing cancer, and most cancers are not growing that quickly. They've been evolving, in fact, depending on which PhD and scientist you believe. Some feel A lot of cancers started 15 to 20 years ago, and some say between 5 and 10 years ago. So if a doctor says to you on Thursday, we need to start chemo on Tuesday, I would say time out. Do some research, talk to some people beyond just the conventional oncologist, talk to an integrative oncologist, talk to a naturopath who's an expert in oncology, talk to some other healthcare practitioners who have great knowledge about this area. Get an array of opinions before you jump into any protocol. So again, chemo in certain circumstances, if you've got a fast-growing cancer or perhaps a tumor that's blocking a bodily function, and we need to debulk and shrink that tumor. Regarding conventional medicine, the NCCN, the National Comprehensive Cancer Network, which is made up of approximately 30 of the top-notch cancer centers in this country, make recommendations to the oncologists nationwide about what kind of chemotherapy protocols they should do. So these are generic, really. They're off the shelf. So if you have triple-negative breast cancer or pancreatic cancer or a glioblastoma, they will say, this is what we utilize for that type of cancer. But it doesn't get down to the basics of you, personalized to you and your personal mutation, your personal situations, and the whole microenvironment that impacts your cancer cells. There's something called the stroma, the vascular environment, the proteins, the infiltrating inflammatory cells. These are things, the signaling transduction, all of these things impact your cancer, the microenvironment. It doesn't get down to those important critical aspects. So there's a doctor in Southern California named Dr. Robert Nagurney. He wrote a chapter in the book, and he does a chemical sensitivity test, which I think is the finest in the world. There's another doctor named Larry Wiesenthal, also a former partner of Dr. Nagurney's. They're both in Southern California. He also has a very similar test. These two, I think, are the most brilliant doctors when it comes to choosing the best chemo types of drugs. And you send to Dr. Nagurney or Wiesenthal a 1 gram sample of your particular tumor, and you have to have this excised by a doctor. You can be anywhere in the country. It's sent in a special medical envelope, and then they test they test 12 to 15 chemotherapy drugs, cocktails, and individual drugs against your specific cancer cells to assess what is working best. And this is as personalized as you can get. It's called ex vivo because it's not inside your body, it's outside your body, but it concerns live cancer cells, your cells. So that is one way to assess the best cancer drugs. And why go through a whole protocol of chemotherapy, which may not work at all, but does a lot of damage and is very harsh on your system, your tissues, and your cells? What about distribution of this particular therapy? Well, there are some people who feel a metronomic approach is best. Dr. Dwight McKee up in the Bay Area near San Francisco feels a metronomic approach is best. Metronomic means much smaller doses over a longer period of time. Smaller doses of the chemo drug means less toxicity. So that's something to consider. And what's really critical is number 3, how do we mitigate this toxicity that is harming our body? It may be killing the cancer cells, but it's also hurting and being harsh to our organs, and there can be a lot of devastating side effects from chemo. 3 things I'll talk about. Fasting. Number 1, Dr. Walter Longo at the University of Southern California. Dr. Longo is perhaps the patriarch of fasting. And it's been determined by many oncologists who utilize fasting that if you fast the day before your chemo, the day of, and the day after, that you mitigate toxicity dramatically because your healthy cells and tissues, especially your healthy cells, can go into hibernation. They can go into dormancy, but your cancer cells cannot, and they are vulnerable to the harsh effects of the chemotherapy. So a lot of people can't fast because they don't have the vitality, but it's not a hard fast in terms of you're not being able to drink water, have light tea and broth, but no solid foods. If you can do that, you'll mitigate toxicity. Number 2, acupuncture. There's a lot of evidence, and this is anecdotal, but there's a plethora of anecdotal evidence. And when you have a lot of data and a lot of anecdotal evidence, you have something you should look at. So acupuncture after chemo, right after chemo, can mitigate toxicity. And number 3, certain herbs and botanicals. Certain herbs and botanicals, depending on your cancer, your stage, etc., can be tremendously impactful in mitigating toxicity. Taking these herbs prior to chemo and after chemo can be very, very helpful. So I go for a non-generic approach. The type of drugs you choose, Dr. Nagurny and Wiesenthal in Southern California can be helpful there. The type of distribution, metronomic approaches, I think can be very wise and helpful and mitigate toxicity by one of those three methods, if not all three of them. So let's talk about the next topic and testing, objective tests. Dr. Dwight McKee outlines 25 different tests in the book. We're not going to go over 25 tests, but I'm going to talk about 5 tests that you really should bring to the table when it comes to assessing your internal condition, your biochemistry, and what you might want to do to pick the appropriate multifaceted approach. There's a fibrinogen test. Fibrinogen has to do with thick blood. If your blood is very thick, that's not a good thing. Cancer cells can hide in that thick blood and avoid the surveillance of your immune system. Your immune system, your T cells, your natural killer cells, your B cells, your macrophage, those are components of your immune system, need to surveil and find the cancer and then attack the cancer. But when you have very thick blood, it's not helpful. So this tests blood viscosity, and there are things that can be done to mitigate the blood viscosity. So assess your blood viscosity through fibrinogen testing. Also, the A1C and fasting glucose test. The A1C test, A as in the letter A, 1 numeral, C as in Canada, A1C, is often given for people who have diabetes. And by the way, people who have diabetes have a greater predisposition for getting cancer. It has to do with sugar, glucose. So we want to mitigate glucose in your body. Your body doesn't need glucose for the most part. We want to mitigate that because it's a major fuel source for cancer cells. And cancer cells are gluttons for this type of glucose, 6 to 10 times more so than healthy regular cells, healthy cells. So by getting an A1C test and a fasting glucose test, we can assess what your glucose situation is, your glucose status, and take certain measures, both nutritionally and through supplementation, to mitigate your internal glucose. So again, getting back to nutrition, avoid sugar equivalents, and also I should mention, avoid pasta, white potatoes, and bread, because when pasta, white potatoes, and bread hits your stomach, it converts automatically to glucose. You might not think that, but that's the case. Try to avoid those foods if possible. So fibrinogen, A1C, and fasting glucose. Number 3, C-reactive protein. C as in the word Canada, C-reactive protein, also known as CRP. Monitors internal inflammation. Inflammation drives cancer, and cancer drives inflammation. So we want to mitigate that internal inflammation and get your C-reactive protein numbers down below 1.0, below a 1.0 status. There are scientists who believe that C-reactive protein is a better way to determine outcomes versus just staging. We've all heard of staging, stage 1, stage 2, stage 3, stage 4. In fact, there's also a stage 0. But C-reactive protein numbers are very important, and there are things we can do to influence that. Copper serum tests. Copper is a cofactor of angiogenesis. Angiogenesis is the internal bodily process regarding the formation of blood vessels. When a tumor reaches a certain size, it needs a source of nutrients. Those nutrients are in the form of glucose, and it creates, through angiogenesis, blood vessels to your blood system and grabs off the glucose. So if we lower the amount of copper in the body, we can inhibit angiogenesis. So getting a copper serum test is very important. And then lastly, out of the 5 tests I am mentioning, vitamin D. Your vitamin D status is very important, and there is strong correlation that if you have a certain status in terms of nanograms per milliliter of vitamin D, you can have a less chance of getting cancer. If you can attain a certain status of vitamin D in your body, it'll help you when you fight cancer, and it'll help mitigate the chance of a recurrence. Between 30 and 100 ng/ml, 30 to 100 nanograms per milliliter is considered normal. But that's a wide range. You want a passing grade? You can have 31, and metaphorically, in an academic setting, you might get a C- or a D. You passed, but you didn't get an optimal grade. You want to get between 60 to 80 ng/ml, 60 to 80. That's an A grade. So work on your vitamin D status, and there are vitamin D3 supplements with vitamin K. Vitamin D3 plus vitamin K together, which are certain things that should be taken to reach that optimal level of 60 to 80. How about, excuse me, a couple of stories of people who have done fantastically well that are in the book. Let's first talk about Diane Klinke. And I'm going to paraphrase and read some paragraphs from her chapter. Diane Klinke had pancreatic cancer. Diane's up in the Green Bay, Wisconsin area, and she was given 3 months to live, and she was told, we can arrange for hospice care. So Diane stated, quote, one Friday in February of 2004, while working at an insurance office in Green Bay, Wisconsin, the entire staff came down with a nasty virus. Everyone went to the local emergency room. Diane had blood work and was given a shot. Thursday, 6 days later, Diane had an ultrasound at a local hospital. She was told she should spend the night at the hospital for more tests. Diane visited with her doctor the next day, and her doctor said, quote, you have a very large tumor in your pancreas, 3 tumors in your liver, and tumors around your portal vein, period. Quite frightful. A few days later, a surgeon in Green Bay told Diane, this appears to be a widespread cancer. You might as well go home and get your affairs in order. You are inoperable and don't have long for this world. Imagine somebody saying that. You are inoperable and don't have long for this world. Nobody knows when you're going to die, by the way. And doctors, I don't think, should say those words because there's lots of people who have beaten the odds. To continue, Diane's medical records were immediately sent to a hospital in Minnesota. It was determined that she had cancer. She had a liver and pancreas, her pancreas biopsied. It was confirmed she had cancer. The oncologist and surgical oncologist in Minnesota said, your chances of survival are maybe 1%. 1%. They said, I would give you maybe tops 3 months to live. We can arrange for hospice care, period. Imagine hearing those words. Back in Wisconsin, a Green Bay oncologist group was willing to treat Diane with chemo despite the grave prognosis. They said, quote, Diane, eat anything you want. You need calories, ice cream, whatever you want. Well, Diane responded and said, quote, I have cut out sugar and dairy, and I'm now taking vitamin C supplements. The Green Bay oncologist said, we won't treat you if you take vitamins. It will interfere with the chemotherapy. That's a perspective, by the way, that many oncologists have, and it's just not factual. It's not based or grounded in any facts at all. In fact, there's a lot of evidence to the contrary, but again, work with specialists. The doctor said to Diane, lady, you are terminal. So prior to starting chemo, a relative of Diane recommended the Block Center for Integrative Cancer Treatment. The Block Center is in Chicago, headed up by Dr. Keith Block. Diane postponed her chemo appointment and made an appointment with the Block Center. And Dr. Block said to her, I offer you hope but no promises. He said, I think we can alter this cancer. Dr. Block also said to Diane, quote, the immune system is like an army. We need to strengthen the army to stop the progression of cancer and to strengthen the body. Again, multifaceted, step-by-step approach. There's no silver bullets that really work that well. Occasionally things can work in a silver bullet approach, but it's not the best approach. So what was the treatment strategy that the Block Center prescribed? Number one, chronomodulated chemotherapy, which is a timed distribution, as in the word chronology, timing. Timed distribution with supplements and vitamins prior to chemo to help normal cells survive harsh side effects of chemo is what was done. And then the chemo was given at certain times of day. The kind of program that Dr. Block has is such that you have a port attached and you can be getting chemo when you're in the produce section. You can be getting chemo when you're on the treadmill. It's not just going to the oncologist's office at 9 in the morning who has you sit in this comfortable chair and has the IV in you at his convenience. There's timing as to when it's best to get chemo or not get chemo. Also, supplementation, and vitamins. Diane got between 50 to 80 pills per day. I know that sounds onerous, but they all had a purpose, and there was an intention for these particular vitamins and supplements to strengthen her immune system. Don't forget, she was told she had 3 months to live. These vitamins were tailored for her condition. Nutritional strategy. Diane was told that certain vegetables and fruits, and she was given a plan. Certain types of vegetables and fruits, whole grains, beans, spinach, green tea, and almond milk would be very helpful. Also, fish. She was not allowed to have sugar, fried food, red meat, dairy, or foods with any white flour. Another part of the program, mind, body, and visualization. Mind, body approaches and visualization to the extent of seeing little Pac-Man swallow up the cancer cells. Practicing these things every day cumulatively can have an effect. There is science behind this. So Diane said, in closing, you must make your body inhospitable to cancer. Diet, supplements, chemotherapy, the way Dr. Block does it. Exercise and prayer are big reasons why I am here today. Diane continued, Dr. Block told me, don't ever consider yourself cured of cancer. You must stay with the program. You may always have cancer cells that could cause problems again, even if you are 10 years down the road. You must change your life. Maybe we have time for one more quick story. Excuse me. This is the story of Janet Summer. Janet lives in Ohio. She had lung cancer with metastatic involvement in the pancreas, liver, stomach, and lymph system. Janet was told, you have 3 to 6 weeks to live. 3 to 6 weeks. Janet was born in Ohio. Her parents smoked 3 packs of cigarettes per day. She had a poor diet. She was divorced at the age of 40. And at the age of 45, 1 month before her diagnosis, Janet felt particularly fatigued. Janet led a stressful life. Janet was also a trained nurse. She had a doctor's appointment. The doctor said you might have bronchitis, but there's no big problem. But Janet was concerned and wondered about her situation. She talked to a doctor, a friend of hers, whom she played tennis with, and asked for an antibiotic. The doctor said, yes, I'll give you an antibiotic, but I want you to get a CT scan because you might have pneumonia. Shockingly, after the CT scan and a PET scan, it showed tumors in both lungs, the pancreas, liver, stomach, and lymph system. On April 11th of 1995, her diagnosis was, you got non-small cell lung cancer. Janet said, and I quote, I was absolutely shocked. The doctor said you have 3 to 6 months to live. There is no hope. Imagine hearing those words. She got a second medical opinion from a hospital in the Cleveland area, and that hospital told her, you have 3 to 6 weeks to live. She told her son, I'm going to die. Well, 1 week after diagnosis, she did have surgery to remove the stomach mass, and she began chemo. The doctor said the surgery and the chemo might buy you a month or 2. So she was going to go through 6 chemo treatments of Taxol and carboplatin, but 3 weeks after her first dose, she went from 114 pounds to 72 pounds. She was a very small, slightly built woman, 114 to 72 pounds. Janet said, I looked like a concentration camp survivor. She said it was impossible for me to continue the chemo treatments. Her doctor said to her, Janet, why don't you try something in the alternative realm? And she said, no, that's for hippies. Anything besides conventional allopathic medicine is nonsense. That was her perspective. Her doctor said, Janet, you have nothing to lose. Look into macrobiotic food. Janet found a macrobiotic counselor in all places in the phone book. Remember the old phone book? She found somebody in the phone book. She met this this macrobiotic counselor, and he said that he wouldn't promise a miracle cure, but he gave her hope. At the time, her lungs were filled with fluid, she was on oxygen, and she was using a wheelchair, and she needed help just to get to the bathroom. Janet was very fortunate to have an incredible support system, and she was now in hospice. An incredible support system of 8 friends who cooked for her daily, very specific macrobiotic meals. Well, after 2 days, remarkably, she stopped vomiting. During the first 5 months, her tumors kept growing, but very, very slowly. She said to her doctor, I don't want any more bad news. And she said, I don't want any more scans. Janet said, "I wasn't into deep breathing and prayer, but deep breathing helped alleviate my pain and help me relax." She also had full body massages, which were soothing. Well, 10 months had now elapsed since she was in hospice, and she'd been faithfully going with a diet and a couple of supplements, and she decided to get scanned to see what was going on inside. So she did have scans. She said she was very scared and curious, but she had lived longer than anyone had expected. So a few days later, after her scans at 9:30 in the evening, her doctor called and said, quote, "All your tumors are gone." Janet said those were the best words I had ever heard, besides, "It's a boy." Anyway, that was quite remarkable. So Janet said, quote, "During my first year in hospice, I gave away almost all of my clothing, thinking I was a goner." She said, "I learned that stuff is not important." Janet said, "I was in hospice care for 18 months. And she said, "I believe how I eat impacts every cell in my body. I am now more open and trusting. I used to be cynical and angry. I believe anything is possible. I thank God for my story because it gives people hope." Janet said, "Since I left hospice, life has been great. People who embrace this lifestyle heal, but they must stay with it 100%. I thank God every morning for the new day before my feet hit the floor." At the end of our interview, Janet said two things: never give up, never give up. I want to say a couple of things about people who I found who were very successful in the program and the 20 people I interviewed. Adherence and compliance to a plan is important. A lot of people are not able to adhere to and comply with a particular program, but that is critical. And attitude's important. Having that fighting spirit is really important. None of us are perfect. There are no guarantees in life, and we're going to have our downtimes, but really finding that inner spirit and complying with an excellent plan with your team of practitioners. So a couple of practitioner pearls I want to disseminate to you. Dr. Keith Block in Chicago said, quote, "I am aware that a patient is sometimes advised by a physician to avoid false hope. First of all, hope can never be false. Hope is not a promise, rather it is a prayer. It is a prayer that can be followed with genuine action and integrative treatment in order to improve one's odds and potentially, hopefully, one's outcome." Dwight McKee, an oncologist up in the San Francisco area, said, quote, "Viewing cancer as a messenger or as a teacher rather than as an enemy can be useful on many levels. There's a role for taking on the warrior persona at a certain point, but it is better if you can evolve to become a scholar, a cancer scholar. Healing your life is a transformational experience, which the challenge of cancer offers." So I just want to tell you, know that many, many other people have walked in your shoes, regardless of your cancer status, regardless of the type of cancer you have. Many others have walked in your shoes and who have survived and thrived 10, 15, 25 years later. And I know this for a fact because I have met these people. I've met hundreds of these people. Also know that there are caring and sophisticated cancer specialists who can offer effective, transformational, integrative, and complementary treatments and therapies that can save lives for all kinds and stages of cancer, including terminal cancer. Again, no guarantees, but there are lots and lots of people out there, remarkable survivors and thrivers, who were told to get your affairs in order, and they are here today, many years later, doing fantastically well. Know that this is true because I tell you, and I'm here to tell you, that it is absolutely true. So in closing, it has been my absolute privilege and pleasure to speak to you today. If I may be of assistance in any manner, please don't hesitate to reach out and contact me. The email address is rick@hopeneverdies.com, and the website is www.hopeneverdies.com. Don't forget, keep the faith, have gratitude, and have hope. Be well. Take care.
Thank you, Rick. What a wonderful message of hope and inspiration. After listening, doesn't it make you feel like you can do it too?
It's a reminder of how much there is to learn about strategies and options when we are faced with a cancer diagnosis. I remember hearing Rick speak at a conference, and he said, "I wish I knew at the time of my father's illness what I know now." And I think that really struck me, that he has done all of this work to help others facing cancer. So we all have the benefit today of this knowledge, and it can truly make a difference.
And we know knowledge is power, and when you have this, you can truly take an active role in determining your treatment plan along with your doctor. If you would like to reach out to Rick directly with questions about his presentation today, or to learn more about one-on-one coaching, please feel free to email him at rick@hopeneverdies.com.
And to purchase his book, Hope Never Dies, you can go directly to Rick's website at hopeneverdies.com or to Amazon. It is a wonderful reference for both patient and caregiver, and it can be a thoughtful, impactful gift to anyone facing a cancer diagnosis. Again, thanks for being with us today. We hope to see you for our next speaker, Carla DeRosa, on November 18th. Carla is a certified food educator and author based in Atlanta, Georgia, who works with clients to expand their understanding of nutrition and health. She will speak about healing through plant-based eating.
I'm really looking forward to Carla's presentation. She's amazing. Finally, we would like to thank all of Faith and Gratitude's dedicated partners, from our event sponsors to all our friends. Without them, this series and all our outreach programs would not be possible. We cannot thank them enough. We hope you'll join us for our final presentation on November 18th.
Until then, visit our website and continue to learn, to research, and be empowered.